Good afternoon, everyone. My name is Beth Brodsky. I'm a clinical psychologist. I'm coming to you from New York City, Columbia University, and the New York State Psychiatric Institute. And I'm very grateful to be invited to this event. Thank you so much to Nazari Petriv and to all of you who are doing such amazing work on the ground in helping families and adolescents in crisis during this horrific situation. And thank you for inviting me to be able to do what I can to support your efforts. So I've been asked to talk about recognizing and addressing suicide risk in adolescents in crisis. And I want to start by quoting my teacher and mentor, Dr. Marsha Linehan, who says that life can be worth living even when there are painful events in it. And that's not so obvious when people are experiencing intense suffering and pain. But it's important to remember that individuals who contemplate suicide are in a great deal of pain, and they view death as a way out of that pain. When we try to prevent suicide, we are not merely trying to stop people from dying. We're trying to help them feel less pain and learn how to manage their pain so that they can be supported in creating a life worth living. And also to support them even after the imminent crisis is past, and supporting them in maintaining hope that they can have a life worth living. That being said, in the middle of the crisis, we do need to focus more on keeping the individual alive and on their safety. So in today's talk, I want to review the relationship of trauma to suicide risk and describe the trauma-informed approach to suicide prevention work and how to recognize risk factors for suicide, particularly trauma-related risk factors, how to recognize how suicide risk might present in teenagers in particular, and then how to ask directly and talk about suicide feelings with adolescents and with anyone at risk, really. I want to dispel certain myths about suicide and suicidal communications that get in the way of asking directly. And I want to talk about how mental health workers and families and friends can work together to support a teen at risk, and how mental health workers and families and friends can get the support that they need for themselves as well. So I just want to define trauma. The definition of trauma that I found on the Trauma Informed Care Implementation Resource Center website, which I think covers it pretty well, is that trauma is exposure to an incident or series of events that are emotionally disturbing or life-threatening, with lasting adverse effects on the individual's functioning and mental, physical, social, emotional, and or spiritual well-being. And acute chronic complex trauma, it could either be caused from one event or an ongoing event or multiple sources of trauma. And what is the impact of trauma? Trauma can impact an individual's view of themselves, the future, and the world. It makes it harder for people to trust themselves, their own decision-making, and their ability to keep themselves safe. They may even blame themselves for the traumatic event that they experienced. Trauma also affects the ability to ask for and receive help, and it can interfere with engaging in treatment or any kind of help that's being offered. Because the world feels like a dangerous place for good reason. And so not only is it hard to trust in themselves, it's harder to trust others. And that could include the medical and behavioral health care people who are trying to reach out to help them. And trauma can make somebody feel that their life doesn't feel worth living. It can cause so much pain and hopelessness and a sense of not having a future. And so therefore, trauma is a very highly known risk factor for suicide risk. So in order to address suicide risk in a traumatized teenager, adolescent, we need to think about approaching the person from a trauma-informed care approach. And what is that exactly? Trauma-informed care understands and considers the pervasive nature of trauma and promotes environments of healing and recovery rather than practices and services that may inadvertently re-traumatize. And I point this out because in all the years that I have been studying and doing suicide prevention work, I was really taught all kinds of interventions to do, how to ask, how to assess risk, how to intervene, maybe send somebody to the hospital if they're at risk. And I was not given the opportunity to think about how that could feel to somebody to just come in and say, I'm going to take care of you and I'm going to do this, 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 and this, without building a sense of safety and trust between me and the person. That I was so focused on trying to keep them safe and doing whatever I could to keep them safe, that I didn't sit back and allow an environment that might encourage more collaboration, listening. I was too action oriented, and the actions sometimes can be traumatizing actions, especially sending someone to the hospital, for example, against their will. That is a traumatic thing to do. So we have to be very careful about not re-traumatizing people when we're trying to help them. So the trauma-informed response care highlights the need for establishing safety, trust, choice, and empowerment. It's a client-centered approach, and it places emphasis on connection before correction. We can't just get in there and do our suicide prevention stuff without focusing on the safety and connection between us and the person we're trying to help. So when we're doing suicide prevention, we want to keep that in mind, that we are also establishing a trusting and supportive environment. And whenever possible, we're trying to offer choice and listen to and respect the person's choices. And that is a challenge when somebody's at risk at self-harm and maybe ending their life. It's very hard to want to give them a choice about what to do. We feel like we have to come in and keep them safe and not necessarily ask them if that's their choice. So that's an important thing to remember. And it's a challenging balance to maintain. And the approach facilitates collaboration and empowerment of the individual to work together with you to keep themselves safe. And we want to conduct all of the things that we do from a place of humility and responsiveness.